Now, the patient is a 58-year-old man with kidney disease who hasn't undergone dialysis due to the long holiday. He presents with weakness in his limbs. Upon examining the heart rhythm, we observe this pattern, which makes us think of what condition. This rhythm indicates hypokalemia or high potassium levels in the blood. If you look at the R wave, it goes down to S and then T. You can see that the T wave is very high and pointed, indicating that there is a lot of potassium, which causes it to be sharp. The QRS complex is also quite wide. If we look at this part, the components of the QRS complex are relatively wide. Looking at this shape, it resembles the characteristics of ventricular tachycardia, doesn't it? At a glance, it does look similar because the QRS complex in ventricular tachycardia is also wide like this. However, this pattern is not actually ventricular tachycardia because we observe that the pulse is relatively slow. Normally, in ventricular tachycardia, the heart beats very fast, around 200 to 250 beats per minute, which is quite rapid. But here, the heart is not beating very fast. If we look closely, it's strange that in ventricular tachycardia, the heart would beat this slowly. Therefore, I have a technique to remember that if we encounter something called VT, or a slow heart rate, we should think of hypokalemia, where potassium levels are high. In this case, we need to administer 10% calcium as the initial treatment if we see that the heart rhythm is abnormal.